Hello, good morning. My name is Juan and I'll be your nurse today. May I have your
Hi.
name and date of birth?
Rita Sochi Estrada, August 14th, 1981.
Alright, so where about you in today?
So, the ambulance.
Alright, what was happening with you that the ambulance brought you in?
I was doing my morning power walk, and then I got shortness of breath and a sharp pain, and then I fell.
Alright. So we did a vital check and your blood pressure and heart rate were a little bit high. Is that normal for you?
No.
No, it's something that's new?
Mm-hmm.
Alright, so I'm gonna do a brief physical assessment. So I'm gonna listen to your lungs, okay? Alright, so I'm gonna go under. Can you breathe for me? Breathe. 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 Okay, breathe. Okay. So I do hear a little bit of crackles in your lungs. So we're gonna have the doctor take a look at you. Can you please lay down? I'm gonna check your legs. I noticed a little bit of swelling. Is this normal for you? Have they ever been swollen?
No.
No? Okay. Alright, so let me go ahead and get the doctor, okay? I'll be right back.
Okay.
Minutes later.
Knock knock.
Hi.
Hello. Hi Sochi. Can I please have you verify your name and date of birth for me, please?
August 14th, 1981.
Okay, so
And I'm Rita Sochi Estrada.
Thank you very much. So I'm Dr. Alicia. I was speaking to your nurse Juan in the hallway. So what brought you into the ER? I just want to verify my facts.
I was doing my power walk,
Mhm.
and I got shortness of breath, and I just fell.
And this is the first time this has ever happened?
Yeah, it's never happened before.
Okay, may I ask a few questions? Any family history regarding this?
No.
Are you currently taking any medications?
No.
Okay, so this is the first time you've ever experiencing sharp pain.
Yes.
Okay, and then your nurse Juan also said you noticed a little bit of swelling in your
Yeah.
legs. Has that ever happened before?
No.
So this is new as well?
Mm-hmm.
Okay, because I was looking at your chart, your vitals are pretty high. Listening to the nurse assessment, there are some areas of concern. So if you don't mind, I just want to also take a listen to your lungs and your chest, and then we'll go from there.
Okay.
Okay, so if you don't mind taking a deep breath for me? One more time. One more time. I apologize for that. One more time. And listening to your heartbeat. Okay, so I do hear some abnormalities. I do want to look into this a little bit more. I'm going to order a chest x-ray and an EKG. The chest x-ray will give us a clear view picture, see what's going on, see if there's anything abnormal.
Mm-hmm.
And the EKG is going to show us your heart rhythm and the electrical conduction of your heart. And with that, it'll also provide an EFR rating.
Why something happened to my heart?
Well, we want to just make sure and check. You know, this is onset for you, first time you're experiencing this. It brought you to the emergency room. So we really just want to get a clear
Am I
picture.
inside?
Let's wait for the results. At the moment, I wouldn't say death, but we just want to make sure what the underlying diagnosis is.
Okay.
Okay, so if you don't mind, please hold tight and we'll go ahead and get the radiology in here.
Perfect.
Thank you.
Thanks.
A few moments later.
Hey Rita, Dr. Alicia again.
Hey.
So your test results came back.
Mm-hmm.
Your EKG did show that there are some rhythm issues. It's a little abnormal. And the chest x-ray did indicate that there is a bit of fluid buildup in your lungs. With the EKG, it also showed an EFR. What an EFR is, it's an ejection fraction rate. What that indicates is how much blood is being pumped from the left ventricle into your body. Normal is 50% to 75%. Your rating came in at 38%. So that does indicate that your heart is not pumping blood efficiently at the moment. Okay, so at the moment, I am going to refer you to cardiology.
Mm-hmm.
This is something I highly recommend to stay on top of because we want to really get to the underlying cause as to what's going on. I am diagnosing you with onset heart failure. So that's why I want the specialist to take a further look into it. You will probably have a few more appointments coming down the lines, possible more testing, but we really want to treat this. In the meantime, I'm going to highly recommend a low sodium diet, prevent some swelling, and I'm also going to be prescribing you an ACE inhibitor and a diuretic to help with the blood pressure. So, do you have any questions for me at this time?
What's an ACE inhibitor?
So it ultimately affects your kidneys to bring down your blood pressure.
Oh, okay.
And a diuretic does essentially the same thing as well. So we just want to make sure there's not enough fluid buildup in your blood or,
Okay.
to diminish the swelling in your ankles or anywhere else.
Okay.
Okay? So
Am I
Thank
gonna die?
I highly recommend just keep up with cardiology. At the moment, I think you're good. Let's get you started on the meds and hopefully that can make things better. But
Okay.
yeah, keep your appointment with cardiology and then the specialist will go from there.
Okay, thank you, doctor.
Okay, so thank you for coming for the ER and getting checked out. I'm going to inform Juan, your nurse, to get your discharge paperwork and he can further educate you on how to get your meds.
Okay, thank you.
Okay, have a good day.
You too.
Later.
Come in.
All right, hi Rita. So
Hi.
I'm back with your discharge paperwork.
Mm-hmm.
So first, you do have a few follow-up appointments with a cardiologist. So please make sure that you do attend them. All the information is listed here. I also wanted to review with you the medications that the doctor has prescribed. The first is an ACE inhibitor called lisinopril. That's going to help with your blood pressure. Second, it's Lasix, which is a diuretic or a water pill. So that's going to help prevent you from accumulating too much fluid. It'll help you pee it all out. And third, we would really like to emphasize that you should try to follow a low sodium diet. That's going to help with your blood pressure and also help with the swelling. We would also recommend for you to keep daily weights so that you can track how much fluid you're accumulating day to day.
Okay.
If in the future you do feel shortness of breath or any
Okay.
chest pain or issues, please come back to the emergency room. Do you have any questions for me?
No.
No, not at this time. All right, Rita. Well, have a nice day. Can I help you feel better?
Thanks.
All right, Rita.
Bye.